Michigan is well ahead of the curve relative to the creation of a health information exchange, which will allow health information data to follow a patient wherever he goes. To better understand the sharing of protected health information through the exchange, let's take a look at the flow of information from beginning to end. The process starts when a patient interacts with his or her doctor at a provider office or hospital. The provider then shares this patient data with the health information exchange of which he is a member. The HIE passes it to the Michigan Health Information Network, or MPHI. From there, it is sent to other health information exchanges and available for providers, the National eHealth Exchange, payer organizations, and the Michigan Department of Community Health Data Hub. The MDCH Data Hub shares the information, when appropriate, with public health data systems, such as Medicaid and the Michigan Disease Surveillance System.
Dr. Beal's, quite a bit more in tune with the technology regarding the electronic health record and the supporting systems within the EHR, primarily the portal. That's a huge communication link between him and I that I did not have in the previous environment.
From a patient perspective, I'm really excited about the fact that accurate information will be available where we're giving care. Instead of having to go back and try to reinvent the wheel or make sure we have the facts right or the timing right, we have that available as a provider. And especially for guys like Randy, where he has a change of health, has something that comes about that kind of demands a different response from the health system, I think there's a safety factor there that's not present in the traditional system of just having paper charts. I think Michigan has a great architecture. I think what we've put out leads the country. I think there's several areas in the U.S. that are actually in a similar situation of moving the agenda, but Michigan has a good handle on this.
It puts more ownership on the patient, I believe, and it's really impacted me in a way to cause me to engage more in my care, knowing that I've got a direct line of communication to my doctor, to my primary care provider, really puts me more in tune with what's been discussed, at the appointment, at the time of care, and really creates that connection.
Now, let's take a look at how the exchange works in the real world. In this particular case, the patient was seen in a hospital ER and referred to his primary care physician. Following the patient visit, the physician shared the patient's data with his health information exchange and with the patient through the physician's patient portal. The health information exchange shared the patient's data with other providers involved in his care using the MPHI statewide shared services portal and other health information exchanges. These providers in turn shared their data with the patient's primary care physician using MPHI and the primary care physician's health information network. Therefore, the data followed the patient to a specialist and back to the primary care physician.
Over the years, we've been laboriously hand-entering data into MCHI, not only putting it into the patient record, but the staff also had to double chart it and then go into MCHI and chart it in MCHI. So that was very, very time-consuming. It was labor-intensive. In the past year, since July, we've been transferring our data by HL7, and now that data goes in real time. So at Holland Pediatrics, as I know in much of the country, much of the state rather, we know that the data has gone from external file transfer to now HL7, decreasing our workload and increasing the accuracy. Now with MCHI in the state of Michigan, we don't have to have missed opportunities. We can pull the record, we can plan the care, we can immunize at each and every visit, which is so important to protect the health of the child, to decrease the disease in a community, and also to decrease the workload of the staff so that we can maximize the time actually spent with the patient. We are able to access this data in MCHI regardless of where they came from, as long as that data was entered into MCHI by another practice in the state of Michigan. So it is a very, very advantageous thing to be able to have a registry such as MCHI to help us in our daily care. Also to have the commitment of our practice owners, Dr. Davis and Green, because everybody working together can make it happen. And it takes resources. It takes a commitment, but it's doable.
In this case, the patient visits his physician for vaccinations that are due. This data is shared with the provider's health information exchange that transmits it to the Michigan Department of Community Health Data Hub. using the MyHIN statewide shared services data portal. MDCH then shares the information with the Public Health Information Service, MICR. From there, MICR makes the data available to other entities interested in vaccination information, such as school districts. The great news is that this entire flow of data is live and operational today.
Michigan stacks up very well. Because we have several different exchanges, that gives providers options. And they're more likely to find an option that suits their needs, and it's helped develop that local activity that's really been the force in the state of Michigan. And we're able to do that, yet still come under the MyHIN umbrella to tie everything together at the end.
Michigan has 7 health information exchanges that both cover the state geographically and offer divergent services to their constituencies, which are made up of individual providers, hospitals, and other health systems. The 7 HIEs are Michigan Health Connect, Upper Peninsula Health Information Exchange, Great Lakes Health Information Exchange, Ingenium, Jackson Community Medical Record, Southeast Michigan Beacon Community, Southeast Michigan Health Information Exchange. A provider organization can join one or more HIEs, depending on its needs and sphere of influence. While the HIEs work together to share and protect patient data, there is also an element of competition between them, which ensures high-quality service for members.
What we've done is really concentrate on connecting physicians and connecting practices, and then aggregating that information into a community record that can be that becomes the foundation for this large network of physicians to share information. If we can come together and create more of a statewide solution, then that allows us, as we're developing those next steps, to be able to maximize our investments, focus our resources, and then really bring the separate activities in alignment. Although the exchanges are largely cooperative, we're still competitive. And fundamentally, I think competition is good because it forces us to be better. And I know that if I fail on an implementation or don't do what I've promised, there's someone else out there who will. If we can help that information follow the patient wherever they're at, then I think we've accomplished our mission. But that's the challenge that we have before us.
In the very near future, all Michigan providers will move patient data to and from every health information exchange via the MyHIN Shared Services site. The site will also provide access to data for other providers, public health entities, payers, and other organizations engaged in the health and well-being of Michigan residents. When this process is complete, our health information will follow us wherever we go.
Health doesn't occur just in the doctor's office. It occurs where we learn, where we work, where we play, and where we pray. So we have to get people involved in the community to start to take control of their own health. And our role is to give them the tools and the information that they can make good health decisions.
Every child should be fully vaccinated and on time. But as we know, with more vaccines come more rules. With more rules comes more opportunity for error. And Michigan, the Michigan Care Improvement Registry, can help you assess at that visit what is due.
This is an iterative process. It's not like you flip a switch and one day everything's there and it's magically available. You start with pieces of information and you make lab results more readily available. You make radiology results more available. You make diagnoses more available, med lists, and you work through the different aspects of a patient record and the different things. And not all tests and procedures and information are of equal value, so you concentrate on the high value stuff first, and then you work your way towards a better and better record and more available information.
Between patients, when I'm waiting for a phone call, when the nurses have something they're doing, it gives me a chance to respond to that thing almost in real time in some cases. That's neat. It's not obtrusive, it's actually just empowering.
It's just a robust registry, and it makes our lives so much easier.
Health should be enjoyable, it should be fun, it should not be hard. And so we need to take our public health messages and our public health information to people and to them where they are.
The dawn of a new day in health information is upon us in Michigan.